Hey, everybody, welcome to the Chiro-Factor. I'm going to be doing this interview with Dr. James Chestnut on a regular basis as a podcast style, really to help out chiropractors. So, James, thanks for taking some time to do this and sharing your brilliance.
My pleasure.
Yeah, we've had some really cool chats about this casually, seriously, in person over the phone. And I think we both agreed it's just time to do this to help chiropractors just disseminate information faster. So thanks for being so forthcoming with the info and so giving to the profession. Anybody who knows you knows that of you, but also for chiropractic students that might be listening, you're in for a real treat. Talk me through some of your education and background, and then we'll dive into the goods. But I want people to kind of know the context from which this is coming from.
Sure. And I just want to say, Brad, that, probably like you, people have been bugging me to do a podcast for a long time.
Totally.
But I always felt that I didn't really want to do one. I'm sick of my own voice because I talk so much anyway. But the other thing is that I really wanted to make it about the science and the practical.
Cool.
And I think, when you and I started discussing, helping people together and the seminar that's coming up in October that we're going to start the series and all that stuff, is that it just seemed to be such a great way to go, listen, let's cover the why or the evidence and then cover the how, which is like, what are you going to do in practice? Because evidence by itself is meaningless if it doesn't translate to patient outcomes and doctor satisfaction and income, right?
Totally.
And so anyway, I just think
and I'm super stoked to be working with you.
Bugging me for all these years. Here I am. We're doing it. So
totally,
enjoy it.
I love it, and I'm stoked to be working with you on a formal basis with what we're going to put together in October, because it really kind of ties into some of the questions I had. Like, hey, here's how we're doing it. Is there science or research to validate if we tried it this way or did it that way, or what would be the ongoing? And you're always my go-to on that, and so. Again, rather than kind of having separate conversations or side conversations, we're going to include everybody in this. And I just love it. I love it. So your education, I think, is super important. The research that you've done, just as we jam through some gives and some gifts here, people understand who maybe have never heard of you. And again, these are mostly chiropractic students, but COVID did a lot of things in separating people. And I want to kind of bring this back to an inclusive conversation.
Okay. So before I went to chiropractic college, I started chiropractic college quite late. So I was in my 30s. So I did a bachelor's degree in like phys ed, kinesiology. And then the story is I had planned to go become a teacher, and I wrote the physiology exam and aced it. And the actual guy, very famous physiologist, always worked with Wayne Gretzky. Wayne Gretzky would never play on a hockey team unless this guy, Howie Winger, was working with him. So he traveled around. So anyway, Howie actually just came up to me and said, listen, this is your niche. You gotta go forward in this exercise physiology thing. So anyway, I did, and I hadn't planned on it, to be honest with you. And so I ended up I was really interested in strength stuff. And I actually was really interested in the neurology of how people get stronger. And so really interestingly, I literally wrote a landmark paper which proved for the first time that strength increased in the absence of hypertrophy or muscle growth, that it was all neurological, all neural drive, all sensory motor cortex stuff, all from afferent input. And so the reason I was able to prove that was because I wrote up a research proposal and I got awarded a research grant and the use of the MRI in Victoria, first person ever from the University of Victoria to get access. And so my grant allowed me to pay the techs to come in after hours because it was so busy, the use of the MRI. And I went and gave the proposal to the hospital and the MDs and the techs, and they all agreed. And so what I was able to do, instead of using a muscle biopsy, and where you just get a small, tiny little piece, I was able to measure the whole muscle. Like the MRI is really the reason the technology was put out was because you basically get the scan, and then you have this stylus. Before styluses were anywhere else, they were in the MRI, and you circle what, like say a lesion,
right,
or a cancerous lesion, and then it will tell you exactly the cross-sectional area of that lesion.
Wow. So
then you can monitor that over time, whether with care, not care, and see if it gets any bigger or smaller with care, whatever. And so it was perfect for measuring cross-sectional area. And that's what I did. And so I was able to, it was published in the Journal of Strength and Conditioning Research in 1996, I think, which is late. Yeah. Anyway, it was late. It was a couple of years later because back in those days, it wasn't email.
Right.
You were sending in hard copies of the paper to the reviewers. They reviewed it, sent you back. Then you had to respond and go back, and so it was a long process. But anyway, um, I was able to prove that you could increase strength significantly with no change in muscle size, meaning that it was all neurology. And so that was my background before I went to chiropractic college. I really had a fairly deep understanding of how afferent input changed the way the whole neuromusculoskeletal system was based on afferent input to the brain and out and all that kind of stuff. And then I went to chiropractic college and it was pretty disappointing, to be honest with you, to start. I just didn't love it, and I was going to quit. Before I went to chiropractic college, I got accepted to do a PhD with a full fellowship, looking at balance in the elderly, because that's all neurology too.
Sure.
And anyway, I just like chiropractic was kind of weird when I got there. Like the profs weren't what I was kind of used to, the quality, right? And it was like this argument about whether it's like cutting off the life force or pain only. I knew neither of those were true. And anyway, so I was going to quit. But
I think it's super important for people who've never heard you just to get that soundbite. And I know you struggle with, talking about the accolades and the intelligence. So I wanted to highlight it because I think it's really important as a context of what we're going to talk about today, that people understand. First of all, you wouldn't be the first person to go to chiropractic school if it was not a great school and have the enjoyment of chiropractic beat out of you. In other words, you go to a chiropractic school and you fall less in love with chiropractic, So I think that's important. And maybe even before that, just the fact that you wrote this paper and had a full understanding of the nervous system, and that muscle girth didn't determine muscle strength. What it was neurology. That is absolutely going to be the spearhead of these conversations, that chiropractic is a neurological conversation, and that's what you're going to get out of this podcast, and who you're getting it from as far as the science goes and the research. It's not just that he reads articles and understands it. It's research is what pulled him into the profession because he's an author. So to me, that's a whole different perspective than, can you interpret this for me and tell me? No, he's done the research. He had the studies. If you know how MRI centers work, they keep those tubes spinning all day long or they don't make money. So it just makes sense that you had to go after hours to do this, which means now we've got a pre-chiropractic student writing a research paper, which took years to get published, but he's a published author. And he was doing the work at 10, 11 o'clock at night to get the work done because he's a hard worker. He's a grinder. And so I think all of that really kind of culminates into some really pointed conversations that our profession needs. And again, I'm just saying this for the people who've never heard you, and that would mostly be chiropractic students, because anybody who's been in the profession for a number of years, you're a household name. But it's a whole different perspective. It's a completely in-depth understanding of research science that you bring to the table, and also some cutting edge perspectives that you brought to the table and then validated, which would all be to our benefit. You don't need to get thick and bulky to be stronger. And that ties into exactly what we're going to be talking about as we go through this. So I freaking love it.
Yeah, and then the cool thing about it too, Brad, is that had I not I was on a rugby scholarship as well, and had I not been very severely injured and no one could help me, I got front of the line everything, right, to the neurologist. First time I learned that neurologists don't do anything except diagnose. They have no care. No neurologist does anything except diagnose. It was bizarre for me, right, because I was so excited to finally got, because I was a bad injury. I won't get into it, but then I finally, against everybody's advice, I ended up, the physical therapist who was the university physical therapist said to me, "You need to go to a chiropractor." And I was like, "What?" And the guy who was on my committee for my graduate work was a sports medical doctor for the Olympic team of Canada. And he told me, "Don't go to a chiropractor." But I was so desperate, I went. And lo and behold, I had this incredible, outcome, which made me interested in chiropractic. And then everybody pushed me away from it on the academic side. My dad's a PhD. All these people were like, "Chiropractor, what?" And then by interest, I started looking into it myself, and I got a hold of the Manga report, which we're also going to discuss at some time in a later podcast.
Yeah.
Which kind of was like, holy cow, all these people are full of shit.
Right.
They're pretending like they know something about the evidence level for chiropractic. It was an incredible epiphany to me, where all these people who had great expertise in some fields were speaking like they had expertise in everything. And what
Right.
I realized was they weren't. They just had opinions. They were experts with opinions, but they didn't have expert opinions. And so that shaped a lot of me too. So I won't get too far into it because I don't want to waste too much time on it. But
No, I love it though. But experts with opinions versus an expert opinion.
exactly right, man.
Huge, right? And I think again, this is going to be important for the listeners. Is this a personal belief? Is this an opinion? And the people that sometimes want to downplay what we do in this profession, just they don't fully understand it, and that's just an opinion, but it's not an expert opinion. So
Including many within our profession,
oh,
Brad.
for sure. Absolutely. And that's a big pull for why we want to do this. So, one of my favorite people, he's an athlete who's experienced the benefits of chiropractic care. And like many of us, that puts you on this journey, on this quest to do this. So, that's the backstory as far as I'm concerned of just who and how this makes it work. But you're also one of my favorite people to hang out with because there's been a number of funny stories along the journey. Can we tell a quick funny story before we jump
Yeah,
into
yeah,
some bullet points? All right. So we were out to dinner recently and we were teaching a seminar together, and it's just like a 2-day workshop, in-depth, hands-on, role plays, just kind of rolling up our sleeves and doing what we do best. I was doing office procedures and how to apply it. James was teaching the science and the research and cutting edge stuff and pivotal conversations and research articles that chiropractors didn't know. What was really cool is we had docs flying from all over the world. So we were out to dinner with anybody not from the US. And when James mentioned Victoria, that's Victoria, Canada, not Australia, but his information's global. I mean, it's everywhere. So we're out to dinner with like a doc from the UK. We had someone from Iceland. We had someone from Germany, from Ireland. And so, small table, 8 of us sitting there, but from all over the place. And James is from Canada and he lives what he teaches, and eat well, think well, move well. All of the things that he's going to go through are just validated and science based, but he's fit, he's healthy. And the guy just lives it. He walks, and I love people that walk their talk. So we're sitting at a table and there's a big event and it's taken a while to get our food. And we all order steaks and we're all sitting there and they put down like 2 warm loaves of bread and and it was like alligator butter, right? Because we were in Florida. So the
It
butter,
was alligator butter. I remember that.
so it's like it's shaped like an alligator. So we're all commenting and looking, and it takes about an hour before like there's any
It was
movement.
long. I remember that.
Yeah, like in the kitchen. So James gets up to go to the men's room, and in the time he goes to take a leak and come back, we hammered the bread.
Yeah.
Right. So he comes back. It was like a flock of seagulls, and there's like shrapnel all over the table, and there's bread comes everywhere. And he
All
just
the butter's gone. There's crumbs everywhere. Oh, I laughed. Man.
there was butter crumbs everywhere. And he looks around the table. He's like, "What happened?" And we're like licking our chops, like I don't know, like a bunch of kids. So the cool thing was everybody recognized that you live it, and nobody wanted to disappoint you. But when he left the table for 2 minutes, we hammered the bread. It was all gone, and then we pretended like we were just having a carnivore dinner. But yeah, that's just who he is, and he demands respect because he lives it.
Yeah,
He
but
does
no
it.
matter how many times I tell people, I don't care what you eat. Like, enjoy yourself. Like, I don't want to be the police guy. I don't care. It was just so funny. And you know what was, the best part of it, Brad, was that everybody had a gut laugh out of it. Right?
Oh,
Like
we were cracking up.
everybody had a
Yeah.
gut laugh out of it.
Totally,
So,
yeah. And then they asked at the end, do you want dessert? And we just started busting up laughing. And the waiter's like, what was so funny about that? And, it's an eclectic group, many different countries represented. And yet we all come together over chiropractic. So I think that's a good jumping in point. Let's do this.
Yeah, that was funny.
That was awesome. So I wanted, one of the things I want to kind of get into is you're huge when it comes to applying the research from the standpoint of the patient's perspective. Now, let's just be really clear. Everything we're going to teach is going to help chiropractors. We want it to help you in your practice. We want it to help the outcomes. And truth is, a byproduct of that is also it's going to push up your profitability. But the first lens we run everything through, you and I, is does it help the patient? If it's not effective, I don't want to talk about it. If it is effective, then the second E is, can it be efficient? Right? Like, can we do it in a practice week in, week out for years and not beat up the chiropractor, not beat up your body, not create extensively long visits where it's not sustainable for the doctor or the patient. So these are the things we're going to talk about. But lens number 1 is, does it help the patient? And what I love that you're so keen to do is talk about what gives the patient the best statistical chance for success. Talk about that a little bit.
Well, that to me is the litmus test. Is that and it's also the legal and moral obligation of healthcare, which is our job is to be aware enough of the evidence so that we can create a care recommendation that provides every patient with the best statistical chance to get the best outcome for the least expense. That's our moral and legal responsibility. And so that has nothing to do with less care is better. You know what I mean? Or you try and get them in as many times as you can just to suck as much money. No, the question is, what does the evidence tell us that is required in terms of a care, what type of care and how long dose of care, duration, frequency of care, what is required, what does the evidence tell us about gives the patient the best statistical chance to get the best value for their money. And when we do that, we get the best outcomes. So we get the best reputation, we get the most referrals. We make the obviously our finances go up because we're busy. And so my thing is I always call it ethical income. So if you're doing the right thing and helping people and providing value and getting paid for that, you should be a billionaire. Because if you are, it just means that every dollar in your bank account represents somebody that you've genuinely helped to have a better life.
Right.
And so that's a great, if you're measuring your money just based on how you measure success, then no thanks. You're not going to resonate with me.
Right.
But if you're using an understanding that the more people you help, your bank account goes up, and you see your bank account as kind of a pat on your own back for helping more people and doing a better job, I'm like, good for you.
Yeah.
And my thing is every chiropractor should be the highest paid healthcare practitioner in their town.
Amen.
If we're not, people are suffering.
Yeah.
If they're not, they're getting the surgery, they're getting the injections, they're taking the drugs, whatever it is, we know doesn't help, harms.
Mm-hmm.
And so until every chiropractor is the most, financially successful, highest paid person in their town, what we know is that people are falling through the cracks and they're getting worse care with worse outcomes.
Right on.
Period.
Ethical millionaire.
Amen.
I love that. Ethical millionaire. It's like a spiritual gangster. You know what I mean? It's just like, it's the right way to practice. And the pills and the drugs, we know aren't going to get, but we face this struggle in our profession. And I'm curious to see if you agree with me that we often underprescribe care, or we don't have the backbone to make a solid recommendation or a best recommendation. Maybe it's from ignorance of knowing what the science is. Maybe it's just a lack of confidence. Talk me through your thoughts on that.
One thing I want to add is that it's not just the number of people who come through your practice that makes you money and means you're successful. They have to be getting outcomes.
That's right.
Right. And the way you do that is by making sure that the recommendations you're making are giving them the best chance. That's what makes it ethical. Mm-hmm. In terms of underprescribing care, I mean it's pandemic in chiropractic. Is that people have been, it's interesting. In the 90s, there was a couple pretty interesting studies. In fact, there was a big, huge panel, a RAND panel in 1991 or 92, and a guy by the name Shekel wrote it up. And what they did was they looked at a consensus amongst chiropractic expert panel about how much care is required. And basically what they said was you're looking at about, 30, 40 visits over 14 weeks. And then some other people started agreeing on this. And then there was this big movement by insurance and by medicine to try to pretend that back pain got better by itself. It was self-limiting and self-resolving. And what was written everywhere, I'm talking about clinical guidelines all around the world. It was basically written that basically the presumption is that 90% of patients will self-resolve within 3 to 4 weeks. Mm-hmm. Without care of any kind, they'll be better. 90% will be better on their own. That only about 2% to 5% will go on to chronic pain. And this is what they started preaching. There was no evidence for it, mm-hmm. but they started preaching it because they were trying to reduce the amount of care that chiropractors were going to get paid for. Because chiropractors started doing proper care plans, and there's two mistakes that were made. And Brad, you and I have talked about this many times, and mm-hmm. the reason why I resonate so well with you, and the reason why we're doing this is because there was two then movements came out of those issues. One was chiropractic schools and chiropractic associations and everything else started pushing chiropractors to say 3 to 5 visits, which is all bullshit. I'll explain in detail. The other thing that happened was then you started having chiropractic coaches saying, sign them up for a year. You know exactly how many care visits they're going to need. You just got to start, increasing the amount of care that you're recommending. which was a turnoff too,
Right.
right? And
Admittedly.
so the response was of this not enough care was bullshit, and it destroyed a lot of chiropractors, and it still has an enormous impact on the mindset of chiropractors because they think they're being unethical if they prescribe the right amount of care,
Yep.
which you and I are going to talk about, and which you've always recommended, which is why I admire you so much and why we get along. But the other one is that we have to admit that some of the response to that was just an arbitrary amount of care that was obviously better for the chiropractor's finances, but also wasn't based on anything solid
That's right.
or of a response to undercare. And so in the middle is the evidence.
Right.
And
And that goes back to being the ethical millionaire, right? Like you don't need to recommend 82 visits for a year-long care plan without doing any check-ins and forecasting and have this crystal ball into the future. But by the same token, 3 to 5 visits is nonsense because it's almost based off of this idea that medicine was promulgating, which is low back pain self-limiting.
And the reason they said that was because two reasons. One is they're terribly unsuccessful at it. And chiropractors were starting getting more coverage in the 80s and 90s, right? So as chiropractors, as the financial disincentive to see a chiropractor was taken away because we were starting getting more insurance coverage, we started to get more coverage even in the socialized healthcare system in Canada, Australia, New Zealand. Well, when the financial disincentive was taken away, people went to a chiropractor.
Right. Like finally we weren't handicapped anymore because we were kind of put on a equal payer system and all of a sudden we were dominating.
Dominating. Yeah. And so that the manga report came out in 93. We'll talk about that in another episode. But all of these reactions to it were panic by the medical cartel, which was like, wait a minute, we need to maintain this monopoly of authority and reimbursement. Both those things go together. But what's interesting was what they were doing to try and justify this garbage was they were doing these studies. And what they did was they called anybody who stopped coming in for usual medical care, they called that resolved. But what they found out was there was a great study in 1998 by Croft et al. And another one in 2012 by Itz et al. ITZ. And what these people pointed out was that this is all garbage. It was in the guidelines, but there was zero evidence for it. What they were saying is people who stopped coming to a medical doctor for care that wasn't working, they called those resolved. Meantime, what they were unsatisfied and they weren't getting any benefits, so they just left the care. They didn't leave the care because they were better. And what they found out was that it looks like about 65 to 75% of these people were still in pain after 1 year, but they just got on with their work or went back to, you know what I mean? Because they had to get on with their lives, but they weren't better. And yet in the guidelines, they started saying that this stuff is self-resolving. Meanwhile, chronic back pain incidence is going up like this.
Right, straight up.
If acute back pain is self-limiting, how could chronic back pain be going up and up and up? It just doesn't make any sense.
It doesn't make any sense, right? So a chronic back pain goes up. They claim it's self-limiting, and yet we're seeing more of it. There's some assumptions that have been made. That's not science.
That's not science. And what happened was that got translated into a lot of chiropractors were persecuted by other chiropractors and by boards. Because all that's on a board is a chiropractor. They don't necessarily have any expertise in the evidence or how to read it or interpret it. And then all this movement is that less care means you're more ethical. Less care means you're not a quack. Less care means you're more evidence based. And that was all absolute bullshit. It was a lie. And so either you were ignorant or you were dishonest when you were propagating that stuff. And so because they were so anxious to get approved by medicine, and then all of a sudden what happened is that then the insurance company started covering only 3 to 5 visits. And then everybody started giving 3 to 5 visits. Right. And then they can look at all the data and say, well, the average number of visits for a chiropractor is 3 to 5. Well, that's only because you told us that's all you'd pay for.
Right.
I mean,
and then when you conform, you reinforce it. And so correct. I get letters if we do see insurance patients, they're like, well, you're out of the norm. I go, you're welcome. Because we're actually getting people better. Could be because we see people more than 3 to 5 visits. Well, this is what everybody does. Well, because everybody does what's covered. And when you conform, you reinforce their data, right?
And the whole movement was so they could pay less.
Right.
That was the whole point of it.
They could pay less. And so this idea of 3 to 5 visits is what they want to be said. And to be honest, there's been some chiropractic consulting groups that are recommending year-long care plans and, 70, 80 visits right up front. The truth is, going back to what you talked about a minute ago, 30 to 40 visits over 14 weeks.
Well, it's really interesting because if you look at so then chiropractors started looking at this themselves, right? Maltby in '08 actually did a couple. He did one on neck stuff and then one on back pain. And what Maltby pointed out was all these studies in chiropractic, they're not looking at what's the dose of care required to resolve somebody's problem.
Say that again. They're not
They
looking
start
at the dose of care.
that's required to resolve the problem. That's not how these studies are designed. That's not what the methodology is. The methodology of these studies is we choose how much care we're going to give in the study before we ever start, before we've examined a patient, before any patient is enrolled in the study or subject. And we say we're going to look at 8 visits or 12 or 2 or 4. And then they give everybody that amount of care, regardless of how much better they get or not. That's the dose of care for the study. Then at the end of that, they measure whether or not there was a significant change, and usually they're looking at the Oswestry or Roland Morris for pain, disability, activities of like maybe some quality of life. And then they go, oh well, 4 visits actually, or 6 visits actually, or 8 visits, or 12 visits actually, had a significant improvement.
Yeah.
They weren't resolved; they were just better than they were. And so what got pointed out was you can't use those studies to determine how much care is required, because that's not care required to resolve the problem. It's just asking whether or not a little bit of chiropractic care made a difference, and it did.
And it
But
was from the design of the study. It's
of course,
predetermined.
and they couldn't, from that study methodology, in any way determine how much care is needed for a patient. It's ridiculous to even suggest it. I won't get too far down, but it just shows such a level of ignorance about research methodology and science, and just what the rules of causation are and all these things. So what's interesting is, so that's Haas in '08, and he's like, or pardon me, that's Maltby in '08. And what does he say? He says, looks like that people are about half better after about 8 to 12 visits. That's in '08.
Right.
And so he's saying, no, to resolve this, you need probably, you're going to be looking at about 24 to 30 visits. And then so that's interesting. Then that RAND panel came out, and it was 92, and then there's Maltby in '08. But then what's really interesting is Haas, Haas, Haas. And he came out, he did a pilot study early on about 2008 or something like that. But then in 2014, he did the only valid study looking at dose of care in the history of chiropractic.
I want the listeners to just lean in right here. This is the brilliance of James Chestnut. I want you to just dive into this. What we've already covered is huge, but this could be a pivot point in your career. I want you to lean in. Keep going, brother.
Brad, this should be a pivot point in our profession.
Right?
My
man. Yeah.
Yeah. And so what Haas did was he recognized, he wrote it, and this is in 2012, I think, Haas, 2014. And so he basically wrote this paper saying, look, the RAND panel in '92 came to this decision, but they agreed it wasn't all on evidence because there was no evidence on frequency and duration of care. There was no evidence. It was all opinion. And so what he said was, well, let's actually look at it. And what Haas found, again, I'm just going to say this again, the only valid study in the history of our profession looking at dose of care. And what Haas study, and a guy by the name of Bromford, who did a huge systematic review on chiropractic as well, published in the Spine Journal in 2008. What Bromford found was the average number of visits in a chiropractic study ranged from 1 to 24, and the average time where they measured outcomes was ranged from immediately after care to 3 years later. And how from studies that diverse could you derive anything about what is needed to resolve a problem?
Right.
And none of those studies went to resolution. They only measured whether or not whatever amount of care was given made any difference in any of those outcome measures. So anyway, bogus. So Haas said, we need to look at this. Here's what Haas found. Landmark study, right? What his conclusion was is he said, look, chiropractic care is indeed dose responsive. The more care you get, the better and quicker the outcomes you get.
Please say that. Please say that again. That part's huge.
Dose responsive. Chiropractic care is dose responsive, meaning that the people who got more care, right? So the people who got 3 times a week versus once a week, right? They went up to 4 times a week. The more dose of care, the faster the results and greater the response was in terms of their outcome measures. So what he said was, look, the best you could expect in clinical practice based on what this study that we've done is that you could expect reasonably that 50% of people in your practice will be 50% better after 12 visits. And I'll dive into that a little bit more. But most importantly, what he said was, from here forward, what this tells us is no chiropractic study ever should have less than 12 visits, minimum. And they've been pumping them out with 1 and 2 visits ever since because they're trying to undermine the evidence for chiropractic, which we'll get into in a later podcast.
I had to bite my lip through that whole thing because I'm somewhere between the hell yeah, let's go, and also like, are you kidding me? I just wanted to let you complete that thought because, again, the reason I said lean into this, like that segment will be a pivot point for many chiropractors. It should be for the profession, but this idea that nothing less than 12 visits. If they're 50% better at 12 visits, they're trending in the right direction. The implication would be more care would be better, that dose response, right? Like the more doses, call it the adjustment.
100%. And they're not resolved. And the truth is, as anybody knows, as an exercise physiologist, I'm sort of very, very familiar with this concept, which is that the response to anything is quick at the beginning. Mm-hmm. So if you think, and remember, not all are 50% better. Only half of them are 50% better after 12 visits, right? Half of them. And even if that half, right, which are fast responders, are half better at 12 visits, they're not fully better at 24 because the speed of recovery doesn't keep that same curve.
Right. It doesn't keep going at the same trajectory.
It's not linear.
Yeah.
It's not a linear dose response, right? It is at the beginning, but then it's just a little bit harder as you go, right? And it takes a little bit more. So the idea is, let's call it 24 visits, Brad, over 24, like 2 months, right?
Cool.
You're not there. You're going to need that third month for sure, just to resolve the acute problem.
Right.
Right. No doubt. Now,
right.
You should be monitoring people every 12 visits. There's no doubt about it. Some are good because we know 50% will be 50% better, but the other 50% won't even be 50% better yet. So some are going to need more care than 3 months probably to get out of acute. Some might need slightly less. Will depend on their lifestyle, their level of inflammation. There's a lot, how much they follow the recommendations about moving around at home.
Yep.
Right? Are they taking the new vitamin D and omega-3 and stuff we'll talk about in later podcasts? Are they keeping their adjustment appointments? Mm-hmm. But the reality is, and this is what's interesting about this, is that when I was teaching this down in Australia, because I started teaching this as part of my spinal health assessment stuff.
Absolutely, yeah.
And so what happened was we had a couple docs get challenged on this by boards, and they kicked ass.
Right.
Because I gave them the IT study, I gave them the Croft et al. Study, I gave them all the shit, and the board just basically went, oh, because they got in trouble for not telling patients that they were going to resolve on their own. They actually had a mandate in the association that said you're supposed to tell patients that if they leave it alone, it'll get better, which was full of shit.
Right.
And so we just blew them away, which is one of the things I really like about this, is that when you're solid in your foundation, you never lose. You're not vulnerable to any of this bullshit or
right.
stuff. But what was interesting about it was everywhere I went around the world, Brad, people would say, that's what Glowaki told us. That's what Glowaki told us. That's what Glowaki told us. And I'm like, did he go over this study? He's like, no, he just told us to do that.
Right.
For whatever, I mean, your experience.
Right. Well, the thing, I learned it from you, and to give credit where credit's due, it's like, I just thought all chiropractors know this. Like, I thought chiropractors dove into this. Like, wouldn't you want to be certain? Because your certainty boosts your credibility, and that gives you the cultural authority. And isn't that what we all want? And I want to kind of highlight something really quickly that you didn't say, but I want to give you credit here. When you went to those places and you helped those chiropractors who maybe were seeing some of their darkest days, when you get a board complaint, you sleep like a baby. If you know what you're talking about, it's like you sleep 2 hours, you cry for an hour, you sleep just like a baby. It's like, because you're nervous, right? But you help these chiropractors out. But more importantly still is you put a lot of these places that you went to on a different trajectory, meaning your help and enlightening the board, your help in supporting chiropractors who are already following your systems and what you teach, then it shifted the culture there. And I'm going to say that you put a lot of countries on a different trajectory for chiropractic, because not only did you support the chiropractor and help them when they were having some of their darker days in practice, but you also enlightened the board, and it shifted the culture where you did that. So you're not saying that, I'm saying that. And the reason I'm going to highlight that is that's part of the benefit of knowing the science and the research, being a cultural authority, and also understanding things like the Haas study, like we just went through, is huge. A few minutes ago, you said, when they eliminated the monopoly and reimbursement, which was chiropractic care was on par in countries like New Zealand, the US.
Almost, not quite, but almost.
Almost, even close enough that there
Yeah,
was an
exactly.
overwhelming response. And then that's kind of what sounded the alarm for them to like push back and try to keep us down. But I think when people understand what you just went through, that too is another major shift. And you're right. We have been teaching that all over the world. I've been teaching chiropractors how to make recommendations that aren't 3 to 5 visits and they're not 84 visits, but it's based on the science and the research. As far as establishing cultural authority, which you and I agree is the next big step for our profession. We need to get this across the board. How do you feel about patients getting to choose, or chiropractors laying out where they let them choose the plan that they're on? How do you feel about that?
I feel two ways about it. One, it tells me that the chiropractor doesn't understand the evidence or their moral obligation to make a recommendation that's based on the evidence. See, one of the biggest things that me traveling around the world doing, like for you, Brad, you're a clinical expert, right? Like you have all this clinical expertise. I was in practice, but I wasn't in practice anywhere near as long as you. And because I just got sucked out for teaching very early on. But one of the things that you have is you have this experience, right? That where you've done this for decades, and you've seen the results.
Yeah.
And so that gives you an amazing certainty, right? But a lot of people who don't have that experience, all they can go by is what they heard, because and then so what they hear translate into what they do in practice, and then it's a disaster. But I think one of the biggest things that's most important is that I took this idea that evidence-based meant 3 to 5 visits, and I proved beyond any reasonable doubt that evidence-based meant adjustment-centric and a proper amount of care.
Right on.
That's evidence-based. Don't give me this bullshit that you're evidence-based. Believe me. And I think that was key to emancipate a lot of chiropractors from these shackles of doubt and feeling immoral if they're giving more care and just doubt. And so, but all of that doubt bred this idea that like maybe I shouldn't push too much care. It's and what a shame. And so the idea that if you're not sitting down and recommending care based on the evidence, then it's going to be, let's make a deal. It's going to be, I wonder what the patient will accept. I wonder what they'll like me for. I wonder I wonder what's not embarrassing or hard to say. And my thing is, no, what's hard to say is bullshit. What's easy to say is the truth, and what for sure gives that patient the best statistical chance to get the best outcome. Now, you can't force it. You don't want to coerce, but you have to be honest. The dentist doesn't say, would you like the braces on your kid's teeth for a week, a month, or 6 months, or a year?
Right. Say that again. Like, you want the braces on your teeth, and then lay out like.
Exactly. And so it's like, no, and so, or if you go to the personal trainer and you're like, you have this goal set out where you want to get in shape, and they go, would you like to work out once a week, once a month, once every 2 weeks? How often do you want to work out? It's like, well, no, the answer is, if the goal is to get better, to get fitter, to get straight teeth, then there should be a level of evidence that says what's required to reach that goal. Right. So when that person's goal is to restore function and health and get out of discomfort and create a stable sort of neuromusculoskeletal platform of their spine, which totally affects their overall health and autonomics and all this stuff. If they want to get better, dude, even if they just want to get better from their subluxation issue, right? Then what the literature tells us with certainty, as much certainty as there is, right? Nothing in science is absolutely certain, but in terms of there's the amount of certainty for what you're telling people is so much greater than anything that's being said that's different. Yeah. It's not even close. So it might be there'll be more research down the road, and we'll go, it's not 24 visits, it's 26, or it's not 24, it's 22, or it's not 35. It's sure. But what we know for sure is it's minimum 24.
Right on.
And anybody who's recommending less than that is dishonest or ignorant.
And I love what you said about the orthodontist. Like, do you want to wear the braces for 6 weeks or 6 months or 6 years? Like, that's not an option, is it? No. So
no, it's not an option.
No. This episode of the Chiro-Factor podcast is not done yet. There's more content coming. However, I want to take a moment to alert you that this will be done on a monthly basis. If you don't want to miss the future drops and you're enjoying this content already, then be sure to subscribe on whatever channel you're listening to. Better still, go to one of our websites and make sure you subscribe to our email list, because we will send it to you at the top of your inbox. And if you're willing to share your cell phone number, we can hit you with an SMS message as well on innatechoice.com, or you can go to levelupmentoring.rocks. Dr. James Chestnut and Dr. Brad Glowaki will be releasing these monthly and complimentary. They will be loaded with science, current research, and ways you can apply this in your practice based on the experience that it works. We're happy to help chiropractors out globally without having to travel. Again, be sure to subscribe so you don't miss the next episode of the Chiro-Factor. Back to our podcast. So I want to give a practice tip right here. So how to infuse a lot of what we've just talked about for the practicing chiropractor and the chiropractic students, the future DCs. The way to infuse this into your practice, and this is gold, is to get permission to proceed. Permission to proceed diffuses the subconscious mind of resistance. A whole conversation you and I are going to have in the future on this is how to diffuse that so people are accepting and at least willing to hear you out. And basically you say, do I have your permission to give you my best recommendations? And there's a little bit of a pause there. Do I have your permission to give you my best recommendations? And when you do that, it is evidence-based. It is based on the literature. And you can get away from this. Do you want to do 6 visits, 12 visits, 24? Because it doesn't matter. I always talk about that's the difference between a luxury and a necessity, right? Like going to the personal trainer. Do you want to go once a month or do you want to go 4 times a week? It's like, well, what's the goal? And if the goal is to improve the statistical chance the patient gets better, then we've got to say, do you want my best recommendation? And in doing that, communication-wise, you're going to see people open up, right? You're going to see people change their body posture as you do that. And they're going to be more receptive to your recommendations. So just a little practice tip on how I've taken some of the genius of James, and I've taught this to chiropractors around the world, is just go, hey, can I give you my best recommendation? Do you want the best statistical chance to get better? And it's an obvious yes. People are like, yeah. I go, cool. But what you've done on a subconscious level is you've got permission to proceed. And when you do that, they're thinking the rest of the conversation, well, I let this person in. I told them it was okay. And they're way more receptive instead of putting up this wall of going like, what's coming at me? And the difference of speaking at someone and getting permission, it's night and day. And so this idea of how to properly communicate exactly what we're talking about, I just want the listeners to have that, and then we can get on with the show of your best recommendation. And again, what we said at the top of the show is that's what's best for the patient. If I give you my best recommendations, you've got the best statistical chance to get results. Can I share that with you? Cool. And we've softened the delivery. We've made it very polite. It's with permission. And I've never once in 25 years had someone say, no, don't give me that. They just go, okay. And
can I ask you a question on
that?
And again, this is like people aren't used to me basically deferring on expertise, but I always defer on the practice side to you, right? Because you're just so freaking, laser on it. But I've always felt one thing about medicine is they don't say, I'm going to give you my recommendation. What they say is, I'm going to give you the research-based or evidence-based. I'm going to tell you what the research says, right? And so for me, I've always taught, and you'll decide what works best because you'll beta test it. But I've always felt like it's like, I'm going to tell you, can I have your permission? And I never use that term. I really like it. I'd always just say, listen, we're at the point now where I'm going to give you the truth about what's required. I'm going to give you and tell you what the research says is required for you to get better. Right. And so it's kind of third party.
Yep. Right.
So I take it away from the doctor's recommendation because that and really what it is, it's what the literature says is required for you to get better.
Yeah.
And I did it a little bit differently. I go, do you want to get better? Mm-hmm. Yeah. Okay. Well, now I'm going to tell you what the literature says is required for you to do that. Right. And it's worded a little bit differently, and I'm sure you could take that and make it better. And the other little semi part of that, Brad, is that when you're saying that when they say, may I have your permission, and I would only say to tell you what the research says, and you say to give you my best recommendation, and you'll figure out what's better because you always do. But my thing is that 2 things happen there. One is the patient opens up, right?
That's right.
But the other cool part of this that I found is that when the doctor knows they're giving the recommendation that's based on the evidence, they're different.
That's right.
They're not feeling like it's a stressful time in the day one, day two. Oh no, now I have to give them the recommendation
Right.
because it's stressful. They're like, now I got to tell you what the research says. So of course I do.
Exactly.
That's my moral obligation.
Love it. And I'll answer this head on. But for the listeners, if you were watching this on a video, an MP4 format, James was literally sitting as I was describing that with his arms crossed, and he had his thinking face on. And then when I said that, what he did is he uncrossed his arms, and you can see how he's sitting right now if you're watching on video. And that's exactly what happens in the report of finding. Like, he was like this, and then I said it, and he does this. And body language, you're opened up. If you're just listening to this, I'm going to give you a hybrid answer. And the hybrid answer is actually both. And I appreciate you deferring to me. I consider you the expert. When I started asking for permission, it had a lot to do with when I teach outside the US. And in certain countries, there's rules and laws that you have to offer per visit. And some people felt like, well, you can come in whenever, or I could show you this recommendation. And it was like an either or. And so to keep it compliant, the language I use in other countries is really specific. And if they're asking for my best recommendation, and the part I just shared, can I give you my best recommendation? They go, yeah. Then I would use a hybrid answer, and I would tie in exactly what you said. Well, what the research shows, and this is based off the most cutting edge science, and we even have it written into a script. Now, people don't have to like a script, but it's transparent. When you get good at a script, you can make it a template, kind of like bullet points for memory. And then when you get really good at a bullet point or a template, you do it innately. But too many chiropractors try to communicate innately. It has a lot to do with their caffeine level. Right? Like, if you're super caffeinated, you're great. If you're lagging, the words come out differently. There cannot be this inconsistency. You got to control that communication variable. And that's the part of the science that gives you predictable results. So it's a hybrid answer. Hey, we're going to go through this, but can I just give you my best recommendation? Yeah, please. Okay, well, this is based on the science and the research. This is based on the cutting edge information. There's some flexibility in how you choose to frame that. But the idea is coming back to exactly what you said, the data, the science, the research, I think is huge. And I even use that in my table talk. But this is, I think the benefit to the listeners is this is like you and I having a coffee in the morning, right? Like these are the conversations we have. So for people to just eavesdrop in on this once a month, to just hear how we think these things through, and that's kind of what's happening is off script here is just kind of talking it through. It's a hybrid answer. Do I have your permission? And that's kind of working the feeling side. And then I would say based on the data and the research, and that's the thinking side. So we have feeling and thinking. And a lot of times people are one or the other, but it's an inclusive because I'm doing both. And you can look at some of this work from PhD psychologists like Daniel Pink and people that really illustrate this, but it's behavioral psychology. And at the same time, it's just kind of like the right way to do it, in my opinion.
And I think for me, maybe, Brad, I was thinking like I'm so focused on the doctor, right? Because I deal with doctors' issues.
Right.
Most of the time I'm like, that's what I do. What I've always found is when the like the dentist isn't nervous when he tells you how long they're gonna right, and the oncologist isn't nervous when they tell you what that's going to be, and the gym trainer's not nervous when they say you're coming in 3 times a week to work out or whatever. But chiropractors have always been nervous, and the reason they've been nervous is because they've had their heads filled with misinformation. Even though I hate that term, they've been lied to. They've been told that one thing is true when in fact the other is true. So when the chiropractors get the certainty, which we're gonna, what you and I have decided we really want to deliver, both in terms of the science and the practical, is that they're going to say, number one, that if there's a law that says you have to offer per visit, well, of course, in a way, always the patients get to choose. But the reality is we'll blow that law out of the water. I'll do that with 2 hands tied behind my back, no problem. But most importantly, what I want, my view on it is I want the doctor to be able to sit there with being totally indifferent about what the response from the patient is. Yeah. Because they're like, listen, if you won the lottery, I can't recommend more care. Yeah. Right? If I find out you're poor, I can't recommend less care. That's unethical.
It's unethical.
The ethical thing to do is to tell you what is required to give you the best statistical chance based on the evidence to get the best outcome for the least amount of money. Once I've told you that, you have autonomy. I'm not a bully. Okay. I'm not coercive. But when the docs get that in their head and they're just basically like, well, here's what you need. Yeah. And they're not stressed out about the response because their response doesn't validate them.
Yeah.
The evidence validated them.
That's right. And there's two parts of that that I think are critical in this conversation. Number one, the assumption in what I just described and laid out as an answer is I have your info in my head. We have these conversations. I mean, you'll text me articles. You know what I mean? Like the assumption is I've got the Chestnut info drilled into me. So I would encourage people to follow up. I just bought your book for everybody in my team, by the way. So we just had a shipment of books come in. They're like, what'd you buy now? I'm like, this is Chestnut's book. They're like, but I thought you teach with him. Why do we need the book? I go, well, it's not for me. It's for you guys. You know, like I think it's awesome. But part two of that is, understanding that it's the science and the research, and I'm going to lay out my recommendations. And I completely admire your perspective because you're always trying to help the doctors, and you have. Your track record's impeccable for 30 years of teaching in the profession. In a soundbite, I would say this to the docs that want to use this going forwards. High intentions, low attachment. It's saved me so much anguish on the weekends when people didn't say yes to the recommendations. And I know they needed it and they should have had it. And now they might be going to surgery. And I go, well, I've done my part. I communicated in the highest value. I base my recommendations on the research. If I gave them 3 visits, I wouldn't help them avoid the surgery in this particular instance. So I did my job. High intentions, low attachment. I can go have fun with my kids on the weekend and my family and spend time with my wife and be happy because I did my job. So I want the best.
Someone would take me 10 minutes and you do it in one sentence.
But I mean, look, we have an equal passion for helping docs, and I've learned a lot of this the hard way because it's ruined weekends, and you don't get that time back. I care about my patients, and the truth is they got to do their job, right? High intentions, low attachment.
We're not responsible for the outcomes. We're responsible for the recommendations and providing our care at a high level. Mm-hmm. But we're not responsible. It's like, you can't take responsibility for whether or not people get better. You can only take responsibility for yourself in this life, right? That's and right. The responsibility for yourself as the doctor is to know what the evidence says and to be honest about it with the patient.
That's right.
To deliver care and information and recommendations that are the highest level, and then God sorts it out. You know what I mean? The rest of it is not up to you. And I think if you can make that detachment, which is my long way of saying what you just more eloquently said, which is, why
I think this is why we're a good yin and yang, though, right? Like we bring some talents to the table that are going to benefit people immediately. And I think this kind of ties into clearing up some headspace for chiropractors. And one of the things you said so eloquently the other day on the phone was why chiropractic's right again. Why chiropractic's right again, meaning the philosophy, the chiropractic paradigm is right through and through. Talk me through maybe an example or time that's come up recently where chiropractic has been right again.
Well, the interesting thing with all this COVID BS, what did you call it?
BS-19. COVID-19, it was BS-19, yeah.
But one of the interesting things was a couple of things really highlighted to me the value of the chiropractic paradigm or philosophy, right? Which is, address the cause, all this stuff. But what you and I have been talking about all the time, Brad, when we talk, people will go, oh, well, what do you guys talk about when you're not on camera? I'm like, this is our conversation, every time we talk because we live it, right?
Right.
But one of the interesting things I remember a conversation we had about COVID, and I've said to people, was like, well, as a chiropractor, I wasn't shocked that pharmaceutical companies might lie about the efficacy and effectiveness and safety of the product. I wasn't shocked that the government might be bought off by big pharma in terms of the regulators, in terms of what they require for evidence or whatever. Or I wasn't shocked that people might lie about the effectiveness of something. None of those things were a shock to anybody who's educated, who's willing to actually not assume that medicine are the paragons of virtue or that big pharma and medical, right? They're
convicted felons.
Of course, 100%. All pharmaceutical companies are convicted felons. They as has been very often said, they actually exhibit behaviors of a psychopath. They know they're making money from harming people. They do it anyway because they know the cost will be less than the profit. That is literally, if that was a human being, and they are human beings making the decisions, but they're convicted as a corporation. But if that was an individual human being, that would literally be classified as psychopathic behavior.
Right.
And that's what they've exhibited for years. And then the other thing, so the other thing was that, well, if you kind of understand that, your body is innately intelligent and it has this immune system, and of course there's going to be natural immunity, like all the things that chiropractors understand, and especially the way we talk about like the importance of a healthy lifestyle as well, and all that kind of stuff, it's like, COVID shouldn't have really been a shock, right? It was obviously an all-in effort, and there was something bigger going on here, but it was the same behaviors that they've exhibited over and over again. Look at the H1N1 pandemic in 2009, how they lied about it.
Right.
I mean, yeah, oh my gosh. So and then they got busted, by the way, with the vaccine pandemic, so which they came out in 2009. They got busted. It was causing narcolepsy, like in huge number of people, ruined lives, and they lied about it. Then they got caught through a Freedom of Information Act. Then they got busted. The governments were lying on behalf of the pharmaceutical companies as well, because the governments were on the hook for paying for the adverse effects. So the governments also lied about it. That was 2009, published in the British Medical Journal. So I mean, if you're aware of this stuff and you're talking about like we do all the time, none of this stuff should have been a shock, or would have been a shock to you.
Right. Right.
Because chiropractors we've had the most evidence-based effective intervention for decades, right? For 100 years or more. And look at the lies about chiropractic that are out there.
Yeah.
So they lie about everything all the time. They're pathological liars.
They are.
And I think that was one of the big lessons I think that a lot of people got is that I think chiropractors who are open enough, that are congruent enough with the paradigm to open themselves up to the facts,
right,
I think they did better through all this.
Absolutely.
Right?
Yeah. And I found it really shocking here in California, if a medical doctor called in ivermectin, that the pharmacies were told by the governor to deny filling the prescription. The governor, a non-medical doctor, denied medical care. And we had medical doctors going palms up like, what the hell? I've never seen this. And so we had patients asking me in the practice, what do you think about them denying ivermectin? I go, well, number one, I'm not going to change my position and suddenly advocate for a medication. That's not my job. That's not what I do. But I find it a bit alarming that the pharmacy suddenly won't fill a prescription from a medical doctor. I've never seen that in my life. So, I'm not advocating for pills and drugs suddenly, but it's shocking to me that there would be a time and a place and have a good track record.
And who didn't advocate for those patients? The medical doctors, because a couple who did got hammered hard. Yeah. And so what you realized was the doctor's license and ability to make money was more important than protecting their patient. Welcome to the real world. That's also an eye opener.
Right. It was.
And never would have accepted that at any time, because they're godlike in their own eyes. But what they realized was, wait a minute, I'm willing to give up all my authority, right, and shut the hell up because of the threat that I might lose my privilege or my whatever, be punished. And so what we found out what the hierarchy was. It wasn't the patient or the evidence. It was keeping my practice and my income.
And I want chiropractors to hear that the highest, leverage point and authority wasn't the evidence. That wasn't where this was coming from. And so then I started looking at what else are they hammering or hiding. And those were the two things. And the other thing was vitamin D. They were hiding the benefits of vitamin D. And I go, why? Because if they're willing to hammer a pharmaceutical product, they must have another pharmaceutical product, which showed itself really quickly. Yeah. And again, knowing that they're convicted felons, I go, there's a game plan here. They wouldn't be putting down one pharma product unless they had another. And then sure enough, that showed up in the form of vaccines. And so that showed up. But then the other thing is they started hammering vitamin D. And you're an expert on this, and you and I know the benefits of vitamin D. I don't think anybody knows it as well as you do. It's an essential. It's something your body absolutely needs. It's a building block for the immune system. So can you just talk me through a little bit of and again, this is just for a chiropractic paradigm. What James and I want to do on these podcasts is do chiropractics right again. And we're going to finish with something where it's our paradigm is right. Maybe you call it philosophy. The point is we want to get in there and do a little floss, and just clean up your thinking a little bit too. So talk me through vitamin D and feel free to give me some X's and O's, because I think this is important. When that was a really big challenge in our lifetime, where your philosophy sat, where your
Right.
belief system sat, really determined what you do. And that has always been the case.
Right.
But I'm also going to venture to say there's going to be other tests in the future. I've been around
Oh yeah.
long enough now. We've seen this. I was in
Sure.
practice in '01 when the planes crashed into the building in New York, in '08 with the financial meltdown and COVID. Like, I know this, there will be other challenges. We've got to get the headspace right. So vitamin D, talk me through some
Sure.
X's and O's.
I'll give you an interesting little quick story. So when this all started, because I've been studying and learning about vitamin D all along, I wrote papers on it, put it on Facebook. I wrote research views on it. I had newsletters for patients out, basically saying, look, vitamin D is absolutely crucial. You have receptors for vitamin D on your innate immune cells, and your T cells, especially your T regulatory cells, and all these things are going to regulate the inflammatory response. Because you don't die of COVID, you die from this inflammatory storm, the cytokine storm, right? That's what kills you from the flu, pneumonia as well, right? So anyway, I basically said, look, there's no evidence on COVID because COVID's new, but there is evidence on the flu, unequivocal. There is evidence on immune function. You need to get your vitamin D in you. I said that I had the guy, the head of the association, Chiropractic Association, Alberta, outlawed my newsletter. So I contacted him. I said, what the hell are you talking about? He goes, well, we can't be telling people to take vitamin D or whatever. It's just for bone health or whatever else. So I sent him like all of these studies. And by the way, my newsletters are always based on a study or more and referenced. And so I sent him these studies and I said, here's the absolute unequivocal proof that vitamin D is absolutely essential for immune function. Will you rescind your stupid thing? And he wouldn't, because they were getting pressure. And I said, you're going to cost lives. Here's what's interesting about this, Brad. The chiropractors who understood this and were recommending vitamin D long before COVID hit, and will be recommending vitamin D and omega-3 too, by the way, long after, think of the lives they saved. Think how many of those people didn't end up in the hospital, because the literature now, then they started studying really good studies on vitamin D and actual COVID hospitalizations, COVID deaths. And what we know is a major significant reduction in COVID severity, COVID hospitalization, and COVID death by people who are taking vitamin D. I mean, unequivocal. And so this is what I try to say to chiropractors. When you're evidence-based and when you're talking about stuff, you gain cultural authority because, number one, don't say anything that's not evidence-based, so you're never going to change your mind. You don't have to, because you're following the evidence. Number two is you're telling people things before they hear it from somebody else, and then you're proven right. So what's everybody now saying? Now they're all admitting about vitamin D, except for the hardest core liars.
And they're also saying treat COVID like the flu, which is what you based a lot of the evidence
What it
on.
was. Let's be honest.
Right. That's right.
It was no. There was. I mean, all of a sudden you had 40. Whatever it is, 140 million cases of influenza for 5 years before
Right.
you get to COVID, and then when COVID hit, you have 0 cases of flu and 140 million cases of COVID. It's just
all these numbers in this statistical category moved to this one. This one dropped down.
People who were vulnerable were the elderly with multiple comorbidities, who were then classified as a COVID death. But every year prior to that, they were classified as dying from heart disease.
And they got really loose with the scientific terms like correlation and causation.
So the reality is, after all this bullshit about them trying to censor people and all this other stuff, at the end of the day, what it turns out is it had an infection fatality rate of the flu. And it was actually less than the flu for people under 40 or people under 70 without comorbidities, and slightly higher for people over 70 with comorbidities. But that's because they didn't treat them.
Right.
If they had treated people as if it was influenza and they gave them an antibiotic when they got super compromised and did all the stuff they did with influenza, didn't let them die untreated for 2 weeks, all the deaths were in the hospital. And the reason they were in the hospital because they were mistreated, they were ventilated, and all this other.
I was going to say the ventilator studies are coming out. It's just crazy.
Take out all the bullshit about how they mistreated people.
Yeah.
And even in the elderly, vulnerable, you would have had a death rate less than the flu.
So what we did in the office, and this is a procedure and a practice tip if you want to use this going forwards, knowing this, what we did is we put little Dixie cups, like shot glasses, disposable cups with your vitamin D products in there. And we said, hey, this is the daily dose of a vitamin D that you need, but it takes 90 days to really get this up and into your system. This is not, we don't treat anything in our office. We don't treat symptoms. We don't treat pain. That's a medical term. We provide the care, the body does the healing. So we kept it through that philosophical lens of
Perfect.
here's vitamin D. This is your daily dose. However, you would need 90 days of this. And this is what the research shows. This is what the data points to. We did whiteboards. We did emails. We did a number of things just showing the evidence you provide. I called you and we shipped down a bunch more of the product to just put on the counter. We did it as a loss leader. We weren't selling it. I said, but if you need this, you'll need this for 90 days. And here's where this is going. And this was, the first 6 months.
90 days to get their body sufficient.
That's what I'm saying.
Like, the rest of their life, right?
That's right. That's right. And again, it's not an anecdote. Oh, exactly. COVID's here. Now I take this. Right. I go, no. You need the ramp up time. But
it was better to start now than never. But it's really
and we still have people coming in thanking us for doing that. We actually did that as a reactivation campaign. Yeah. Come on in and get your vitamin D and understand what this is. And people go, what are you talking about? Because there's all this uncertainty. And we stepped up, and I had chiropractors complain, and I had people in town call me quacks. But now we're right. And if you want to build authority, this is some of what James and I want to do in the Chiro-Factor, this podcast, is we want to reinforce your certainty. He and I aren't afraid to get into controversial topics, sensitive topics. Look, part of being a leader is you're willing to step up first. This is a topic that we talked about through the pandemic. He put out information that got him in trouble with provinces in Canada because they just rolled over for their narrative. California wasn't any better. And we kept our practice open and we did these things. And I want to, again, come back to the point that I'm sharing this because I want to instill that confidence in the chiropractor. There is a way to practice within this paradigm that's good. There is a way to do this that will stand the test of time. And that's a lot of what we want to share with you. And it's based on evidence. It's based on research.
Yeah. Evidence, research, logic, and ethics.
Love it.
Right. And you got to put all those things together to be phenomenal at being a human being, at being a father, at being a doctor, at being a spouse, at everything, right? So the idea is that the only way we can make good decisions. By the way, life is about the quality of your decisions and your actions. That's what defines our quality of our lives and the quality of us as human beings. And the only way you can make good decisions is with the right knowledge, applying that knowledge properly with logic, right, and experience, and ethics. Mm-hmm. And so for me, that's the formula for success in everything. Mm-hmm. And when you have those things, so you don't yak about what you're not sure about. Right. If you don't know, you say so. I'm not sure on this, but this could be helpful. I'm not sure. If you're sure, you say I'm absolutely sure this could be helpful, right? And I think that's one of the things and what's really interesting about all this with COVID was such a great lesson because the people who had been staying healthy prior to COVID had virtually no threat from COVID. Mm-hmm. None. So they say, oh, lifestyle doesn't really save lives. Yeah, it does, man. It doesn't just prolong life and make your life better. It saves lives.
Absolutely.
Basically, COVID was a lifestyle illness, right? Because it was only the people with poor lifestyles leading up to COVID got really sick from it for the vast majority. And what's really interesting, what they showed was because they did comparative studies and they said people who were sufficient in vitamin D prior to getting COVID, already sufficient, did way better than even the people who who started taking vitamin D when they got COVID. Right. But the people who started taking vitamin D when they got COVID did significantly, astronomically better than the people who didn't take vitamin D when they started to get COVID. But the best were the people who have been taking vitamin D and omega-3, by the way, because it's so important in the whole inflammatory pathways. Is that so those people, what's cool about it for me was because the omega plus D product I have, which is vitamin D and omega-3 together, the people who have been using that because it's so important for the inflammation and response to the adjustment, been using that for years. Well, guess what? Their patients were basically strolling through this whole thing with no issues. And when they started telling about the importance of vitamin D, they're like, I know you already told me.
Right.
That's just an enormous benefit. So these people were killing it during COVID. No pun intended, but they were just.
So just to be clear, did you open this vitamin company in the middle of COVID?
No. No. And so I always love that for chiropractors because I just think chiropractors are so underappreciated in their communities and they underappreciate themselves in terms of their expertise. But listen, when you do the right thing over and over again for years, you will always get a reward. That's how this universe works. I mean, yes, shitty stuff happens to good people. I get it. But over time, right? The moral arc of the arc of the
Yep.
universe bends towards morality, as Martin Luther King would say. And like, if you're doing the right thing and practice over and over again, eventually what's going to happen is that people are going to all of a sudden have an eye opener. So for the
That's it.
people who are doing the right thing all along, what COVID did was cemented their value to their patients.
Right.
Do not close, please.
Right.
Please stay open.
Right.
It was completely different for those chiropractors.
Again, the conversation we had over the counter in my practice was we would put out these cups and say, here's your daily dose. You need to be ramping up over the next 90 days. And then at like 90 days, more or less, your body's got what it needs, but it isn't like take this and you're good. It's a process of going through it. But anybody who said thank you, or anybody who was like, wow, this is amazing, this is great. And anybody who we were doing recalls, trying to get him in and convince him it was safe to come in and get adjusted, who said, I have one of the comorbidities. Unfortunately, we have cancer in our family. We would ship him the bottle for free. Number one, it's cost effective the way you do that. I do, if I haven't said it, thank you for sending me the extra bottles in challenging times. But we would ship him a free bottle and just say, look, I've seen James Chestnut cover this as a study for breast cancer, the intervention of vitamin D. And if you've got cancer in your body, hey, this bottle's a gift from us. Take a look at this article. And we just gifted it. And we put the article in there. We put it in a box. And I had my CAs. And we would do this every week. We'd be shipping free bottles to people just because I felt like this is our time to put a flag in the sand and say, this is what we stand for. This is what we stand against. And just what you said, on a long enough timeline, we will be proven right. So let's put as many actions into place now that seem crazy. And down the track, people will thank us for acting the way we did.
Exactly.
So thank you for providing the extra vitamin D.
What I love about that is that it shows exactly why we've decided that we got to get these seminars going together and create this drive of people hearing these things, right? Because, you take that and then all of a sudden you take it and you go, I'm going to do a moral gesture, which is also a practice builder. They're not mutually exclusive.
No.
Right? You've just taken something and said, I can do the right thing, but it's also going to be a recall. And it's like, that's the idea. Take the right stuff, take the right evidence, and turn it into a better practice. Yeah. And that's what I love about what we're doing, man, is that
we took photos of stuff at the counter. We put it out there, and one of my newer CAs was like, well, what's the cost? I go, this isn't a cost. This is an investment into the future. We need to plant seeds now that we're right later. We'll get the fruit from this down the track. There's going to be a return on this that's exponential because we're doing it the right way. Yeah, we're going to hook up on an event in October and teach you the X's and O's and the science and how all this dovetails together. October 2024, we're going to be doing something called best practices, because it's the best practices for patient results. It's best practices for the science and research for chiropractors to have the certainty. Best practices in communication. Quit offering 6 visits, 12 visits, 24, 48. Let the patient choose. You give away your authority. You give away your cultural authority when you let them choose the plan. The orthodontist doesn't put braces on teeth and say, do you want to do this for 6 days or 6 months? What's your best recommendation?
And you give away your ability to get those best outcomes consistently. That's the best practice builder.
Yeah. It's
the best confidence builder. It's the best practice builder. It's the best referral generator. Don't give away your ability to consistently get don't give away your statistical chance to get the best outcomes for patients, because that's what the foundation.
I love that, though. You can't give it away, right? Because if they choose 6 visits and statistically that's not going to get it done, you're out of ethics.
And what do they tell everybody? I tried it. Chiropractic doesn't work.
Yeah. You cannot give those options to the patient. It's just you're giving away their statistical outcome. You got to have a backbone in this profession. I'm sorry, it's required. So as we kind of wrap this thing up officially, just so you know, in October we're going to be doing some really cool stuff together. What should I have asked you? What things should we have double clicked on? Any information you want to circle back to? Because I think inflammation in the body, cytokine storm, just getting inflammation out of the body isn't really the juice, right? Like
no, you got to, and we can do this next one because I know you love this part of it, which is that we'll make the distinction between anti-inflammatory and pro-resolving inflammation in the body, because that's how your body works, and anti-inflammatory stop both. Unfortunately, that's why they don't work. Omega-3 and D and adjustments push you in the right way, as does, moving and exercise and all this stuff. So I think we'll probably cover that next time, because we're a fair bit into this now,
cool.
Brad.
We'll cover it next. We'll cover it next podcast.
Yeah, we got months and months of these to do. We got so much information to give out. One thing I'd like to ask you is, like, because you've been so gracious in asking me about my background and all that stuff. But what I really want to, what I want people to get excited about is because when you and I finally decide, okay, let's do this. We're going to do this kind of this pilot thing in October. But what's our goal, Brad? Like, what's your goal with this? Give me your background, why you chose to work with me, and what you think we could accomplish over the next couple of years if we get together and get these people into these best practices. What's your vision?
I think COVID kind of put a stop on a timeline for a lot of people. A lot of our lives will be described as pre-COVID, post-COVID. And I really feel like there's some lost time in between during COVID. And I mean, heartbreakingly lost times. My daughter was a senior in high school. She's an All-American lacrosse player, and she played 4 games and season was canceled.
Yeah.
We didn't get those games back. She's a scholarship athlete. She plays in college. So for her, there was a next chapter, but we didn't have graduation. She didn't have a homecoming. All these things, and that's just one of my 4 children. There's a pre-COVID conversation. There's this lost time during, and then there's this after. And I really feel like if you were pre-COVID, you know who James Chestnut is. And I teach at some chiropractic schools. I'm around students, and a lot of them don't have this understanding of the science and the research. They do not have this confidence. And I'm seriously concerned for the next generation, or maybe for chiropractors who got beat down through these tough times. And there's a lot of them that have, and they just haven't gotten their swagger back. So if that's you listening and your practice used to be this and you're describing it pre-COVID and now it's that post-COVID, we want to help you. And working with you, the procedures we teach, the science you provide, the certainty we synergize on, I know we can really shift it for the chiropractors that have kind of found themselves in a rut. And I always tell you the difference between a rut and your grave is about 3 feet. It's about 1 meter. You could be in a rut for so long, and all of a sudden it's the death of your practice. It's the death of the joy. And so for me, it's bringing back the enthusiasm, the science, the excitement. We do work with pro athletes in every major sport, NBA, NFL, NHL, and they've also won the world championship in every major sport. What I've seen consistently over time and in 25 years of practice clinically is the athletes and the doctors figure things out first, being the chiropractor, and then the science will catch up with us. They will figure out that cryotherapy helps their body and does these wonderful things. And now 20 years later, this is like a fad. I can't tell you how many athletes used to climb into ice water bath chambers that they made out of trash cans and trash bins, and they would climb into clean. It was just used for that, but they would take a ladder, climb in, fill it with water, put in ice. And most of my athletes were doing ice baths 20 years ago. Now it's like, oh my gosh, are you familiar with the Soderbergh method? And look at activates the brown fat and the adipose tissue. It's like, I know, but my athletes did that 20 years ago. I'm glad the science is catching up. And that's very much the case in chiropractic, right? Unfortunately, the athletes figure it out. The science will catch up. And now we've got to catch up the chiropractors to the science, which is what you're so great at, is like, it's already out there. And now we've got to catch people. So it's almost like we're so far behind for a number of variables and reasons and research that just feel compelled to help these docs. And to me, that's always been a passion. If I can do it live and immersion style, I'm not afraid to jump on a flight and go to Australia for the weekend and teach and come back, because it's better live than it would be video. So my commitment and our track record, I think together is really, it's been proven. And I know chiropractors will get the results. And ultimately to me, that means the results for the patients. So that's where it's at. And to me, I'm excited for what we're going to be doing in October and beyond. These podcasts have already spent an hour and change, and we're going to have to cut ourselves off because it can just keep flowing. And to me, that's what's exciting, and that's what keeps me sharp as well.
And I just think what's cool about you that resonates with me, and I want to say this, is that when you do get something that you might not have heard before and it's good evidence, you're like, I'm willing to take that. I might have to tweak something. Like you're not one of these people who says, no, I'm never going to change. You're always adapting your stuff. You're always humble about it. You're very confident in what you do, but you're always willing to say, if I can get better, I'll do it, which is one of the really things that I like. And I feel the same way, right? Like even before COVID, Brad, and we've had this conversation many times, right? There was these big coaching programs. They all disappeared in '08. Not all of them were doing things that you and I would recommend, but sure, they help people. There's no doubt about it. But there was always a little something that didn't feel right somewhere about it, right? For both of us. And, the fact of the matter is there's still 50% of our graduates that fail. And right now, 50% of our profession at least is struggling.
Yeah.
And they don't have to. This is not complicated. The science is easy to understand. The protocols are easy to understand. How to build a practice is easy if you follow the right advice. There's variables that determine success or failure in a practice. And I think you and I, when we come together, have covered all of them.
Yeah.
And so for me, man, I want to see this thing take off, and I'd love to see rooms full of 1,000 people again of chiropractors who are successful, happy, confident, having fun, getting great outcomes, having a great life, and making a difference all around. That to me is my vision. As you know, I don't love traveling anymore. But you twisted my arm on this.
For sure, I did. Yeah.
An agreement on was, I'll do 3 or 4 big ones a year, maybe 5. And that's what I want to do. I want to help a lot of people at once, and then I shift them all over to you for your coaching, because that's not my strength, it's yours. And then you're going to take all this stuff that we're teaching, and then you're going to help them implement it. Right. And so, I mean, I just, I don't care whether you're already great or you're really struggling. There's going to be something here that allows you how to make your practice grow, make it more efficient, get better outcomes, feel better about doing it. Or maybe just relax a little bit more and enjoy it more if you're already busy. Learn how to get an associate, which you're so good at. So, man, I'm just telling you, we want to see in October, and it's like I'm just really excited for the first time in a long time. I'm really excited about something that's going to take chiropractors and make them not just more financially successful, not just better outcomes, but enjoy it more.
Yeah,
enjoy the profession more, have more pride in it. Have the fellowship again in large rooms. I just want to do that again.
Let's do it. I'm stoked. Yeah, it's going to be fun. So when you say 5, does that include Australia and a European one?
Australia, Europe, 3 in the U.S. or North America, I think is fair. What do you think?
Let's do it, buddy. I'm stoked. Let's fire this thing up.
So October's the kickoff, and we should get people from everywhere so you can at least see it. Give us your feedback, all that kind of cool stuff, right?
Yeah, totally. Your teams, let's get the energy back in the profession.
Got to have the team there.
Yeah, we need to get our swagger back, and you got to do it as a team. There's no way to come back and then plug it back into your team. It's going to be a cohesive message, and one I think a lot of chiropractors need to get behind. So thank you always for your time and your expertise, buddy. Let's do more of these. I'm stoked, and just for anybody listening off the record, he is the coolest cat. Like, he's just super fun. So just keep the bread off the table, ladies and gentlemen. Please know there will be future podcasts for the Chiro-Factor. Each month we'll drop free content information. Whichever medium or platform you heard this on, be sure to hit the subscribe button. If you haven't done so yet, you can also register on innatechoice.com, or you can go to levelupmentoring.rocks. As James and I did this particular podcast, we were so inspired, we decided to host a live 2-day workshop we want you to know about as well. The live 2-day workshop will be called Best Practices. The best in science, the best in evidence, and the best from my experience of how to apply it in practice. The Best Practices workshop will be James and I teaching live, side by side in Salt Lake City, Utah, in the middle of October. Again, to get those notifications and messages, either go to innatechoice.com or levelupmentoring.rocks. And if you're willing to share your cell phone or your mobile number, we can send you SMS messages of promotions, future podcasts, or information of when we host the best practices in Australia, future dates beyond the October date in Salt Lake City, Utah, and even in Europe. Again, the Best Practices live seminar will be James, Chestnut, and I teaching side by side. The Chiro-Factor podcast will be dropping complimentary on a monthly basis. You can register for both at innatechoice.com or levelupmentoring.rocks. James and I are thrilled to share cutting-edge current information to help chiropractors get their swagger back. And cheers to those of you listening all the way through to the end. These are the kind of docs we want to help. People who have the best interest for their patients, the best interest in the science for results, and we want to help you with the profitability of your practice as well. We'll see you there at the Best Practices live workshop, or you can listen to us monthly at the Chiro-Factor podcast. To register for future notifications and information, please go to innatechoice.com or go to levelupmentoring.rocks. Either website, you can register for the notifications, the podcasts, and the information and promotions coming up for best practices. Again, innatechoice.com or levelupmentoring.rocks.